Hi, friends, and welcome to the Dr. Green Mom Unfiltered podcast. This is your host, Dr. Ashley Mayer. I feel so honored to have this opportunity to support you and your family on your parenthood journey. Just a note before we begin, if you enjoy this podcast and would like to support my work, please consider subscribing at drgreenmomvip.com. Subscribers have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. As always, I appreciate your support. And now let's begin. I think we're recording.
Yay!
Yay! This is our first recording podcast in a while, right, Theresa? Dr. Theresa?
It's been a couple months.
Yeah, it's been a while. And this is our first podcast that we're actually pushing out to the public because up until today, we have only allowed our Unfiltered podcast to be inside our VIP group. So for our VIP members only. And we decided that we'd like to give all of you a taste of what Dr. Green Mom Unfiltered is like. We are raw and real and kind of edited depending on how things go.
We'll see how it goes.
Dr. Theresa and I tend to talk a lot. Okay, so today, Dr. Theresa, what are we talking about? What's coming down the pipeline? I think it's top 5 something or other.
We're talking about some of the top questions that we've been getting in our VIP group, the Facebook groups, Instagram groups, just a lot of questions floating around about vaccines. And so we wanted to just talk about some things we thought maybe aren't obvious or that people should know.
Yes. So if you have followed Dr. Green Mom or know anything about the company, I am a vaccine neutral physician. So I am here to dish out the benefits and the risks of both diseases and vaccines. And I let you, the parent, make that decision on what is best for your family. And Dr. Theresa is like everything you ever want to know about vaccines, she knows it. So I am so excited to have her on today. She's also the other half that makes Dr. Green Mom whole. So she's my partner in this, I don't want to say crime.
Adventure. Journey.
Adventure.
Mission.
Yeah, so Dr. Theresa has been with the company for a couple years now. No, 4 years, 5.
I don't know, 2020.
I think you're going to say 20 years, but we've known each other for 20 years. I feel like our mission started 20 years ago. How's that?
I think so, yeah.
Okay, so the one question that's on everybody's mind right now, yes, we do have a measles outbreak now in 2 places. So there's one down in Texas, and now there is one in New Mexico popping up. And there is a lot of information out there floating around the atmosphere, and what's on people's mind who follow Dr. Green Mom is, where are these cases coming from? Are they vaccine-derived? Are they wild? Who's giving it to who? And so we wanted to touch on that first. So we wanted to touch on that before we talked about anything else, is a measles update. And so, Dr. Theresa, I have the Texas cases pulled up right here as of March 7th. So as of a few days ago. As of March 7th, Texas has 198 cases. What I'm actually looking at, I wasn't looking at how many cases Texas has. I was more interested in their vaccination status. So I had it pulled pretty far down here on the texas.gov website because I'm interested in who has what, right? Like that's why we're here to talk. Dr. Theresa and I were going over this before we started recording, and I told her these numbers, and I'm going to let her touch on it. So currently, of the 198 cases, those who are not vaccinated, there's 80 people who are not vaccinated. And those who have been vaccinated with at least 1 dose are 5 people. What is really interesting to note is that the unknown status, we do not know whether 113 people were vaccinated or unvaccinated. So what do you think about that, Dr. Theresa?
I think it's a mystery. It makes me a little concerned about what's going on public health wise, because that would be like reporting to the public health office about, who's getting what. And I think it's pretty standard to know all the numbers, isn't it? Is that what you usually see when you're looking at it? Is there usually such a big unknown number?
When a patient comes into the emergency room or doctor's office, the first question that's asked by the nurses or whoever's caring for the patient initially is, what is your vaccine status? So for there to be 113 unknown cases, that tickles me because why aren't... Anyway, I'm going to leave it at that. So there's 113 that we absolutely don't know about right now. And then in New Mexico, this new outbreak, there's been 30 cases in New Mexico, and we actually don't know anybody's vaccine status yet. They have not reported it on the newmexico.gov website. And so now we want to touch on, here's all the cases, here's what they're reporting, whether it's vaccine status or unvaccinated status. Theresa, what are the chances of someone getting the MMR vaccine and then shedding that to someone else and causing them to actually get measles?
Right. And so, because that's going around right now on social media. So as far as we know, and we did a deep dive to figure this out for you guys in case there was new information. But as far as we know, as far as looking at people who did like a real deep dive into the research, I think it was the Journal of Vaccine, you said?
The Journal of Vaccine, over 700 papers, published papers that they looked through and analyzed to see if we have ever known of a vaccine-derived case of measles to someone else other than someone who was immunocompromised, and not a single one did they come up with. And that was probably 7 or 8 years ago that they did that we were taking a look at. And that was over several decades. So over several decades of research, not a single case of vaccine-derived measles in a person. So I think it's important that we make that clear, because there's so much of this information. Like, find out these people who have measles, find out if it's vaccine-derived or if it's wild type. And so we're here to say, probably with like 100% probability, every one of these cases were wild type. So that's the first thing. What else about measles, Dr. Theresa?
I will mention that sometimes they will, and then there's some cases in the literature where they'll test, say, a child with a rash who has recently been vaccinated to see, do they have measles or do they have a vaccine reaction that's a rash that looks similar to measles. So that does happen sometimes.
Yeah, the CDC Pink Book for measles shows that up to 5% of people who are vaccinated with the MMR vaccine will show symptoms of measles, whether that's a fever and a rash or just a fever, up to 5%. So 5 people in every 100, correct, Theresa?
Yep.
Will show symptoms of measles. That is separate from taking that symptomology and handing it off to another person and them getting measles as well. That is what we're saying doesn't happen.
Yes, and sometimes people take that and say, oh, the vaccine causes measles. And so there's also a difference between, there's some transient symptoms that look like measles versus the whole measles disease complex, which tends to be much more severe.
Right. The measles vaccine is a live attenuated virus vaccine. It means it's live, but it doesn't have much going on with it. It's got just enough going on with it to give you antibody protection, but not to give you full-blown measles. Do you want to touch on the different types of rashes that we'll find in people if they're nervous about contracting measles?
Sure. So the measles rash tends to be a darker, kind of lacy looking rash. Like if we're just talking about like after the MMR vaccine, whereas the rubella tends to be like bumpier. And then the chickenpox will be the small blisters, which aren't always fluid filled after a vaccine.
Yeah, so those are the three rashes to look out for when you get vaccinated. The measles, the MMR vaccine contains measles and rubella in the vaccine. And Dr. Theresa and I were talking this morning that if you do get a rash after the MMR vaccine, it's typically the measles rash, not the rubella rash, correct?
It could be any of them, but it's most commonly the measles rash that,
Okay.
well, like a rash that resembles measles.
We were going to talk about the oral polio vaccine and shedding, and we were going to talk about rotavirus because that's where we're getting this information from, the shedding. So it's live virus vaccines may shed. And just because they are a weaker virus, they are not actually dead. They are an attenuated, weaker virus, and so they may shed. And we definitely see that in the oral polio vaccine, where shedding will cause cases in other individuals. That's why we have typing for vaccine-derived polio typing and wild polio strain typing.
And it's totally worthwhile to note, I think, that we don't do the oral polio vaccine.
Right. And why don't we do the oral polio vaccine in the United States, Dr. Theresa?
Well, because it can spread, so it just doesn't make sense. But it is used in places where polio is endemic, especially during an outbreak, because it can be more effective in that sort of a setting.
Correct. So the IPV, which is the inactivated polio vaccine, is given here in the United States. The oral polio vaccine is given mostly to the countries who are endemic to polio, and two reasons. Money is one of the reasons, and the other one is that it actually works better during polio outbreaks. There are a few other notes that we do want to touch on with the MMR and the age that we can start dosing the MMR. If there is an outbreak in your area and you do have a little one, a little kiddo. Theresa, do you want to touch on that?
Yeah, so as young as 6 months, you can dose MMR. And the reason they don't usually doesn't have to do with side effects, so that's not something to worry more about than at an older age. The reason they don't is because it's not as effective. So
Correct.
It doesn't count towards your vaccine series if you get one earlier, and sometimes they'll give them for people traveling or during an outbreak. But then you still, to be fully vaccinated, would require the one dose between 12 to 15 months, and then the next one 4 to 6 years.
Yeah, and so it's also interesting to note that none of these vaccines are as effective in your infancy for the same reason. Your immune system is still being primed. And so having these vaccines at such a young age, they're not as effective. But when we give them multiple doses in a series, they are effective. And the reason why we dose at such a young age is because this age is the most vulnerable. Yeah. So we have a super vulnerable population. What do? The vaccine's not very effective at this age, so we give multiple doses. And that's why you typically see multiple doses on the schedule for infants that are such a young age. What about, Dr. Theresa, when your kiddo, say a lot of these parents are in the midst of this outbreak, what would you suggest to them if their kiddo is not feeling well? Do they get vaccinated? Do they hold off on it? What are your thoughts? These are just our medical opinions, by the way. Don't take them for anything.
Don't take them for advice.
Don't take them for advice.
And I saw that's a really good question, and that's where it gets tricky. Because when your kid's got the sniffles, there's so many, especially a little one. Is it teething? Are they about to get real sick? Are they fine? Is it just the tail end of sniffles? Is it allergies? It's March. What's going on? And really, I think I really think you'd want to have an assessment from a doctor that was like, okay, is there allergies, or oh, it looks like teething, or oh, let's give it a couple days and see, are they improving and getting better? Is this just the tail end of something? Like personally, I'd be fine with the tail end symptoms. Or is it ramping up and in a day you've got a high fever? You don't want to do a vaccine on top of something serious, I don't think.
Yeah, so I'm going to go ahead and say I always err on the side of caution. Yeah. So if a kiddo is just coming down with something, you don't know how bad it's going to get. And so if they're just witnessing symptoms, I would definitely wait at least a couple of days to see what the symptom picture looks like. If it continues to get worse, obviously, definitely don't go in to vaccinate, in my opinion. But if it's getting better and they're on the upswing and they're right at the tail end, I wouldn't see a problem with it.
And I think, what are the guidelines? I think mild to moderate to severe is what the contraindications for the CDC and on most of the...
Yes. And I like to talk about that because what I find interesting is, how does your doctor know what's moderate if you're just starting an illness? If the illness is just showing its symptoms, how do you know where it's going to go? Yeah. So when they say moderate to severe, I like to say mild if the symptoms are just coming about. I will err on the side of caution. And it's really interesting. You said, like, talk to your doctor about it. All doctors, most doctors are like, no, it's fine. I'm just going to give you that shot today.
I suppose, you know what? You're right. And the thing is, that's not my experience with doctors.
Dr. Theresa has had really great experiences with her doctors. And so some of us find it so far-fetched to think that a doctor will be like, all right, I'm dismissing you from the practice if you don't vaccinate, or all right, if you don't get vaccinated today, your kid is going to be potentially dead.
Yes.
When I took my daughter in, I was currently going through a divorce at the time with my ex-husband, and we were going through a lot with regards to vaccinations. And when I took her in, this doctor was so fear-mongering, and she told me that if my child didn't get the pertussis vaccine, that chances are likely she could die. And so I, from the get-go, have had such awful experiences with other healthcare providers, even though I am a healthcare professional myself. And so I love that Dr. Theresa has the other side of this, where she can say, you know what? I've had really great experiences with healthcare providers. And so I love that we both have these opinions.
Right? Because, I mean, the people who've seen you will be like, just talk to your doctor about it, because your doctor's so great and they'll let you know.
There's nothing but Dr. Ashley Mayers in the world. They're all allowing you to vaccinate according to the schedule that you want. Duh. Yeah. And unfortunately, that's just not the reality. And so again, at the end of the day, if it's the beginning of anything, I would err on the side of caution and I would reschedule the appointment. If it is on the tail end of things, I would see no problem making an appointment to go in to get that MMR if that was something that you wanted to do. Now, we just wanted to touch on this real quick, right, Dr. Theresa, about allergies to vaccine components.
Right.
Yes. And I just pulled up some quick examples because I know people like examples. And so we know that if your kiddo has an allergy to egg, you definitely don't want the flu vaccine or was it yellow fever?
Yeah.
Yeah. And then I just pulled up some information on the polio vaccine real quick, just so I could tell you like what is an example of what's on the FDA package insert. And I'll just read it right to you. That in the iPol vaccine, it's contraindicated in persons with a history of hypersensitivity to any component of the vaccine, including 2-phenoxyethanol, formaldehyde, neomycin, streptomycin, and polymyxin B. Those are ingredients in the polio vaccine, the IPV vaccine, iPol. And so those are antibiotics. Formaldehyde, we all know about formaldehyde. And phenoxyethanol is an additive. I think it's a preservative, actually. So we just wanted to touch on that. And I think this is where we can go on to the next thing that parents really need to know about vaccines that we find fascinating. Right, Theresa?
Yes.
Okay. So do you want to do the intro? Because I find this so fascinating, and there are doctors talking about it. There are people in social media talking about it. But to what extent is really interesting. So I'll let you do this.
Yes,
This intro.
I know that you just this morning sent me a video where someone had mentioned something like this. And so I know it's currently going around social again. But it's basically that vaccines tend to not be tested against inert placebos. In fact, in our research that we've done, we haven't found one tested against an inert placebo.
Can you explain that, Theresa? Because a lot of people will say, what the heck is an inert placebo?
Inert placebo? Those are two words. So generally when you're testing something to see what the side effects are, you test your experimental medicine or vaccine against something that should have no side effects other than, say, an injection. So
saline.
So saline would be an example of an inert placebo. Like if you got a saline injection, yeah, maybe your arm would be sore. Maybe placebo responses that your brain came up with would come up. But you would sort of compare that to the medicine to see how much more is the medicine causing.
Correct.
So when you want to see what is an acceptable increase in side effects, yeah, I would think it would be against an inert placebo, right?
Correct. What we want to do is we want to test a vaccine that we want to bring to manufacture. We want to know if there's known side effects. We want to know what the safety profile looks like of this new medicine, this new biologic, which is a vaccine that we want to bring to market. And so common sense says that you want to test that in a random controlled trial, a double-blind random controlled trial where you have a placebo group who receives saline injection or something very similar. Then you have an experimental group who receives this new vaccine that we're so excited to bring to market because it's going to be so amazing. So as an example, Dr. Theresa and I were talking recently, the Prevnar 20 came out last year. I think it was last year. And it is a vaccine against 20 strains of strep pneumonia. Now, the previous vaccine was the Prevnar 13, which was 13 of these dangerous strains of strep pneumonia. The first vaccine was Prevnar 7, which was 7 strains. So we have 3 generations of the Prevnar vaccine, and each time they manufacture a new Prevnar vaccine, they add more strains to the vaccine. So Theresa and I were talking, and what is so incredibly interesting, guess how they tested the safety profile of the Prevnar 20 vaccine? It was not against a control trial of, say, saline. The control was the Prevnar 13 vaccine. So they're saying the safety profile of Prevnar 13 is fantastic. Let's see if Prevnar 20 tested against 13 has any more side effects or different side effects for us to decide whether we bring the Prevnar 20 to market.
Yeah, and then the 13 had been tested against the 7. And then the 7 was tested against, I can't remember, meningitis.
Yes. So the very first Prevnar vaccine was Prevnar 7. It was not tested again against a control of a placebo. It was tested against the meningococcal vaccine. So a completely different vaccine to look at their safety profile. I find that fascinating. And then we went down a rabbit hole to see what the meningococcal was tested against. I don't remember. I think we have it written it down here somewhere.
We went down quite a rabbit hole. But so to sort of bring some context.
Yes.
So
Theresa, help us.
When you're continuing on with the pneumococcal and saying, okay, well, there's sort of some ethical concerns. Like if you're giving everybody Prevnar and you feel that it's necessary and saving lives, you can't just stop giving people Prevnar so you can give them a placebo instead.
I get that.
So the newer ones kind of do sort of need to be tested against the older ones to see if they're better or at least not worse. That part makes a lot of sense to me.
What she's saying is this is ethics. So it's unethical to tell you as a parent that your child just got vaccinated because it's a randomized controlled double blind. So nobody knows what they got. So no parent is going to feel comfortable wondering, well, what if my child didn't get the Prevnar vaccine? And what if there's an outbreak? Or what if I need to know if they've been vaccinated or not for it. So we're trying to be okay with understanding that the way that they're doing clinical trials for a newer generation vaccine is by testing it against the older one. But you can do a 3-arm study where you test it against the old generation, plus you also do a placebo test of a control, which is maybe saline. Mm-hmm. And we're not doing that. But what I find fascinating is, what the heck does the Prevnar 7 vaccine have to do with the meningococcal vaccine? So when they brought the Prevnar 7 to market, their blinded study was off of the meningococcal, which isn't even strep pneumonia. So is that not unethical?
I don't know. Honestly, it's a mystery to me.
We're confused.
I'm confused. Let's just leave it at I'm confused. I think that they said, well, if you're okay with this amount of side effects already
in the meningococcal vaccine,
we should compare it to what we've accepted rather than 0. I think that was how that went.
Apparently, there's an accepted amount of side effects that are okay. Like, it's okay to have this amount and not okay for this amount. But what is this amount against that amount? And I know you played the ethics card, Dr. Theresa, but I wonder about the ethics part of it if the initial Prevnar 7 was not, in my mind, ethical because they tested against meningococcal. I'm so confused.
I don't know because we're also not experts in this. We're educated people. We're trying to understand it. But we can't speak with authority. Oh, this is what happened, and then that's why, and this is because
we're trying to decipher this information. And what we find fantastic is, as educated as we are as physicians and as much clinical practice as we had, we're even struggling to swallow this information and try to make sense of it. And so Theresa and I are highly, highly ethical individuals. And so we want to think that everything is ethical. And and so this has been interesting. Now, I just want to throw this in. I asked Dr. Theresa today if she remembered which vaccine was tested against the DPT vaccine.
I can't remember which one it was.
Well, I found it.
Oh, you did?
Yes, it's the IPOL. It's the IPV vaccine.
Oh.
It wasn't only tested against the DPT vaccine, but one of the tests, one of the control trials was the DPT vaccine. Do you want to talk about what happened to the DPT vaccine, Dr. Theresa?
We don't give that one anymore.
No.
Because the rate of side effects is too high, we changed it for the acellular pertussis instead of the whole cell pertussis. We changed that up.
Yeah, so in the current vaccine package insert, For the only single polio vaccine that we offer, the IPV vaccine, inside the vaccine package insert still shows clinical trials with the DPT vaccine, which we do not even use anymore because of the severity of side effects. And Bob's your uncle.
I don't know. I get a little overwhelmed, a little frustrated because it's stressful to me.
I think at the end of the day, parents just want to know that the vaccines were tested with a control, a placebo control, and they're not. And that is what's circulating right now because there are people starting to come to light. There are doctors and other healthcare providers who are now saying, wait a minute, I never knew that vaccines weren't randomized control trials with a placebo. They're controlled trials against another vaccine. So, Dr. Theresa, can you tell me about, let's say, the MMR vaccine back in the day? Or, let's talk about that. Like, which did the DPT vaccine have safety trials? What's recently come about in the last couple decades? Like, we're doing trials now, but vaccines coming to market years ago.
Years ago, they didn't so much have the same standards for safety trials, which is just because it was a different world. And also because it was a different sort of environment that you're giving a vaccine in. If you're giving a measles vaccine in a place where measles is everywhere, so you're comparing it to not getting a measles vaccine, really. Like, measles is just unequivocally worse than the vaccine. Just, like, far as we know, as far as, like, rate of death or severe
symptoms,
long-term side effects. So that's just, I don't know, it's obvious, I guess. So they didn't, I don't know, because I wasn't there, I wasn't born. But they just didn't do the RCTs. And I don't know that it was gold standard at that point. The randomized control trials. I just don't think it was standard at that point. So what we do have, though, especially for the older vaccines, is long-term observational studies, long-term post-market surveillance. So it's not to say there's no safety data on these. There's considerable safety data on them.
And when she says safety, she's not saying they're safe. She's saying that there's information to let you know what the potential side effects may be. And we call it safety data.
And the rates of those. And those you can find the package inserts. You can find them on the CDC website. You can find them in our vaccine strategy guide and our e-course.
And it's under post-marketing surveillance.
Yeah.
What happens is that once a vaccine comes to market, we give it to communities, we give it to cohorts, and then we sit back, not we, they sit back and they wait to see what side effects come in. What is it that parents or people are experiencing after they get the vaccine? So having said that, Theresa, do you want to touch on VAERS? It's the Vaccine Adverse Events Reporting System. And a lot of parents are told, oh my gosh, if your kiddo has a side effect, you have to report it. You have to report it. What's the point behind VAERS?
Right. And so as I understand it, so VAERS is there for reporting. It's more like a signal detection system. Like a lot of times people, and sometimes even researchers, will take VAERS data and use it to draw conclusions. But the conclusions you can draw from VAERS data are kind of, they're like, we should do more research, is sort of the conclusion you can usually draw from VAERS data.
Right. So as an example, the new RSV vaccine that came out recently.
Mm-hmm.
Tell me about the signal that happened with VAERS.
Right. And we just updated our ebooks with that. So there was a signal detected that there is a higher risk of, was it Guillain-Barré syndrome, I believe it was. Not detected in pregnant women. This is detected in people over 65, I believe.
Well, I think there was just a bunch of random reports to VAERS, and then that launched the signal, to tell researchers we need to look into Guillain-Barré and the RSV vaccine, right?
Yeah.
And so they tested, was it a Medicare cohort? It was a cohort of older individuals that they looked at. And that is what led them to add the Guillain-Barré warning to the vaccine package insert for RSV.
And so when you're testing something like Medicare or Medicaid data, forgive me because I don't quite know the difference between those things.
Dr. Theresa is Canadian. She's a Canuck.
Yes, but if you're looking at hospital data, medical records, that's going to be more complete data in general. Still not perfect, but it's going to be better than VAERS data, which is not going to be perfect at all.
So I think at the end of the day, what we're trying to say is take that VAERS data, not to draw conclusions, but to allow for further testing.
Yeah, I think so.
Ooh, so this next one, this is the third thing that we wanted to talk about today. And this has to do with vaccine clinical trials. And this is another, I can't believe that this is how they do it. But they have to because due to ethics. So this next one is vaccine clinical trials often include only healthy people. So as an example, I just did a video on Instagram regarding the rotavirus vaccine. And the first rotavirus vaccine that came to market was quickly pulled within 1 year because of such severe side effects of intussusception. It's where your infant's intestines like roll into each other. It's called telescoping. And they pulled that vaccine from market. Now, the next generation of the rotavirus vaccine that they wanted to bring to market, they did clinical trials on. Dr. Theresa was helping to update these flip books that we have inside the Vaccine Strategy Guide. And she brought it to my attention that the clinical trials done on the new generation of vaccines did not include any infant that had any potential pre-existing bowel condition. So that vaccine was tested only against healthy infants. Correct, Theresa?
Yep. And so in the package inserts, there's a big list of everybody who was excluded from those trials.
Correct. So that's a struggle for parents for sure who have a child with a pre-existing condition, because vaccines are not tested with children who have pre-existing conditions in mind. Vaccines are only tested on healthy individuals.
So then that leaves a question, because often those pre-existing conditions will make an infant potentially more susceptible to the disease. So it would be of a higher interest to those parents. And then we're left wondering, does that also make them more susceptible to the associated adverse events from a vaccine? And then we just don't have that information.
No, so I completely understand a parent's position. Hey, my child has XYZ diagnosis. My child, even things like my child has chronic constipation. You know, I have an infant who's 6 weeks old suffering from chronic constipation. Do I get this rotavirus vaccine? And that's the question that many, many parents have to try and answer without much help from their healthcare providers, because most conventional pediatricians will say, absolutely get the rotavirus vaccine. So I think that's why we're here, Dr. Theresa.
Well, and the thing is, even if they didn't just say that, if they were talking to you, what would you say? Like, what kind of... So we made a note of some questions you could ask your pediatrician that might be helpful for making the decision. Like, how common is the disease right now in your area, in your cohort? Is your medical center prepared to treat that disease? I mean, if we're just talking about rotavirus, I'm guessing that yes, they can treat that. And sort of non-vaccine ways, to help prevent it. But when it comes down to like, what do you think I should do? I don't know. How would you go about that conversation?
I'll typically, in my practice, look at current cases in the area. That's what I do. And that's typically how we make that decision. But I'll tell you how hard that is now, because the CDC for 2025 just updated how to find current cases in your area. And it is so incredibly difficult to find this information as of 2025.
And I think they're updating it, once a month now? Is that right?
It used to be weekly. So through the end of 2024, they updated every single state in the union's case count weekly. And it was a beautiful chart. And it was so nice to be able to go through it and see it. I told patients and I told all of you out there how to do it. And now it has just become extremely difficult. So what to tell patients now when we have very limited data to go by when it comes to current case count in your area, I don't know what to say. So it really comes down to all of the other risk factors. You know, vaginal versus cesarean birth. Are you breastfeeding or formula feeding? Do you have older siblings who might bring something home? Do you have any other current diagnoses? Like, it really comes down to all of the other questions that we ask parents to make an informed and educated decision on their schedule. And so I commend you parents for researching and looking into this information, because as difficult as it is for myself, having been practicing for 15 years as a physician, and for Dr. Theresa, my apologies to you as a parent for having to try to find all of this information on your own. How's that?
And just for clarity, I'm not a practicing physician. I'm working with Dr. Ashley, helping her out with everything.
Yay! She's not just helping, she's running things. She's like running all things. So yeah, Dr. Theresa is a retired physician.
Yes, so knee deep in education and learning and on teaching and all those things is the focus. But
thank you for being here.
Yeah, happy to be here.
So number 4 on our list is something that I feel conflicted with, because I tell all of you that I'm a vaccine neutral doctor, and I'm here to give you both the risks and the benefits of diseases and vaccines, and I let you make the decision. But Dr. Theresa and I were just talking, we all have personal biases. And so I know my personal bias has to be reflected in me talking and what I talk about. And so what we want to say is, wherever you're gathering your information to make an informed decision, please don't assume that one place that you received that information is the truth or is 100% factual. I want you to look somewhere else to also find information that corroborates what, say, I'm saying. So I don't want you to leave this podcast after listening to it and say, oh my gosh, did you know that vaccines are only tested against other vaccines? I want you to go look at it. Grab a couple package inserts, and I want you to take a look at it, and I want you to see for yourself what that vaccine was tested against. And you can see it in the clinical trials area, the safety area of the package insert. So having said that, I want Dr. Theresa to touch on this, because we had a really in-depth conversation about this recently.
So about like our personal biases?
Just our personal bias and some of the places out there in the internet that are claiming to be one way, or a certain, like there's outfits out there who are doctors, who are healthcare providers, who claim to be for informed consent and medical freedom. And Theresa grabbed some data for me recently on one of their social media platforms.
Yes, because Ashley had sent over to me something and said, what do you think about this? Because the data they were presenting was very different from our data that we were actively deep in the research, updating currently. And the data was so different. And so I think, oh no, did we miss something? Did we make a mistake? So immediately checking the references, going back to the research, like, how did they come to these conclusions and why are they so different?
Wasn't it death rates? It was presumed death rates of these diseases.
It was saying the long-term risk of death or disability from a polio shot was 200 per 100,000, which is one in, I can't do math. What is that? I think that's 1 in 500.
Death.
So, like, you're telling me, sorry, I shouldn't laugh. It's not a funny, but what's funny is the inaccuracy, and like, we would have noticed, I think, surely. Also, that's so far off what all of our research has shown. It's not 1 in 500 people getting permanently disabled or dying after a polio injection. That's wild.
But if you look at their graph, it's beautiful. Like, it's very professionally done.
Professional, referenced. And so I went back to the original reference to see where did this come from. And it is completely misrepresented. The research is old. It's on different vaccines. It's misinterpreted. And the thing, I think I got so upset. It was like 8 a.m. trying to get my kid ready for school, and I'm just fuming.
I know, we talked about this
Because if I think back to when she was little, and I had read that,
your daughter,
when my daughter was little, and I had read that, it had all of the signs of being reasonable, reputable, trustworthy information.
This graph was very legitimate looking.
I would have just believed it, I think.
And then you would have opted not to get the polio vaccine.
Oh, absolutely not. I would have been like, that is a crazy decision, is what I would have thought. And so, other than just it being really upsetting, because we're in the middle of doing it. That's why when we looked at it, it was like, that doesn't look right. Because we're in the middle of looking at it. But if we had just maybe started our looking at vaccines journey, or
if we were another healthcare provider, not you and I, but another doctor or healthcare provider who's trying to start learning about vaccines, the first place we're going to go is those who are currently looking into it. Yeah. So informed consent organizations and medical freedom organizations, these healthcare providers are looking to them for evidence-based information. And so when they grab something like this graph, they're going to probably look at that as truth. So to wrap this little part up, whatever you hear from an individual or a doctor or a scientist, and it resonates with you and it really hits you in a good spot, just because it makes you feel good doesn't mean you don't go and try to find other evidence that corroborates what it is we're talking about. So if you are more of a neutral person with vaccines, or if you are anti-vaccine, or if you're pro-vaccine, and I say something to you that really resonates good, that makes you feel good. So if it's an anti-vaccine comment that I make about there's a lot of problems with randomized controlled trials and vaccines, that's an anti-vaccine statement. And if you really resonate with that and it makes you feel good, don't just take that for the truth. I want you to go research it for yourself. So anything that Dr. Theresa and I say, anything that any other doctor or scientist or just person on the internet or social media says, there is actually a lot of misinformation out there. I know that we're very, very used to seeing on like Instagram, this is misinformation. Some of it wasn't always misinformation. A lot of it was, but some of it wasn't misinformation. And so go look and see if you can find, I want you to try to go find information that either corroborates what I have to say or that is in direct contrast of what I'm saying. I want you to try to debunk what I'm saying.
Absolutely.
Don't take what we're saying as the absolute truth, even if it really makes you feel fuzzy inside.
I'll also say, can I also add something?
Absolutely.
It's boring. The truth is boring.
I am so glad that you just said this.
If it's exciting, if it's going viral, it might be tweaked so that it's more exciting. Because in most situations, most people, it's just people working hard, doing their best, imperfectly moving forward. There are benefits, there are risks.
you get anything out of this podcast, or if you get nothing out of this podcast today, the one thing I hope you get out of is what Dr. Theresa just said. The truth is boring. Social media depicts like what is it? Fanaticism, sensationalism. That's the word. I'll tell you personally, I know before I push a post out on social media if it's going to go well or not. I know before I even put it out there, because if it doesn't have controversy, people don't care. Like, that's the sad reality, is that the truth is boring and there's not much conflict. So I love that you just said that, Dr. Theresa, because that is at the end of the day, you hit the nail on the head.
Yeah. Yeah. And if something's like, oh my goodness, it's being presented that way.
I think, is that what we got today?
I hope so. I hope we weren't boring.
Oh my God, I think we were amazing. I don't know what we're recording next. We're recording again in 2 weeks. What are we going to talk about?
I don't think we decided. Should we put a poll in the VIP group?
Should we put a poll?
A poll.
Yes. So y'all, you guys, we have a VIP membership. And of course you know about it because you've finally gotten to the end of this podcast. And can we put that in the parent support group, Theresa?
Yeah, let's see, why not?
Yeah, let's, we're going to put a poll in the parent support group on what people are super interested in. And we'll just start plucking from what you guys are interested in and what we're going to talk about. I always know that people want to know about vaccines, and I most especially know that everybody wanted to know about what's going on with measles and any updates that we had. We do have a beautiful measles handbook. We'll put it in the show notes. And so I hope you grab that. It's also available to you in the VIP membership. And so if you do have any more questions about measles, please feel free to take a look at that. And I think that's it, Dr. Theresa.
I think we covered it. Yeah.
This was so much fun. Thank you so much for being on with me. And I cannot wait for 2 more weeks to go by for our next podcast episode.
Looking forward to it.
All right. Have a nice day, y'all.
Bye.
That's all for today's episode, but I have so much more to talk about. So join me and my staff of like-minded physicians at drgreenmomvip.com. We are here to support you on your parenthood journey. As a member, you'll receive access to my very lengthy library of parent-focused resources, including my treatment protocols, access to my private parent support group, and exclusive product discounts. As always, I appreciate your support in making these conversations possible. Thank you for listening, and I'll see you next time.